Welcome to Inquire and Inspire, a podcast exploring connections and community with our co-hosts, Brent Flickinger and Layla Kohler-Frew.
Hey Layla, it's great to be with you.
It's great to be with you. I haven't seen you in a while.
Yeah, no, it's been since our last time we did this. Anyway, I've got to start off today's show with some sad news.
Uh-huh. Yeah?
Yeah, well, you're waiting for this. Okay. Did you see the obituary today about the man who created the wind chill factor who died?
No.
Yeah, it's really sad. He was 86, but he felt like 75.
Oh, Brent. Oh,
What?
that joke is just so old.
Oh, I guess it's pretty old, as the term wind chill factor was coined in 1939 by a man named Paul A. Sipple.
Well, I'm really glad to know that important fact.
Today, I'll be interviewing two people I'm excited to bring together for the first time. Both of them are planners. One thing I've noticed about planners, such as myself, is that we look at issues holistically. We know that a successful neighborhood or a community needs to have more than one or two assets. Affordable housing, access to jobs, open space, and public safety are all necessary, really, in any successful neighborhood. As planners, even if we focus on one aspect of planning, such as economic development or capital projects, we know that all these issues are important to a successful community and a good quality of life. I'm reminded of some of the work done by a person who has informed and affected my views about community, John McKnight from Northeastern University. He talks about a concept called asset mapping. I know you're familiar with that, Layla.
Yes. For example, there could be two different maps of a neighborhood under stress, and one of them would identify problems such as vacant buildings, drug corners, streets needing repair, and issues like that. Another map, an asset map, would identify assets like the schools, the churches, recreation centers and programs, local shops. One of my favorites, some of the people. People can be assets in their community too, and amenities in general.
As a city planner working in neighborhoods, I've seen plans that include maps that are selective in what they identify. For example, all the map has is problems.
Yeah, I've seen that too. You know, one of the things that I reflect on is how people who live in a neighborhood have their perceptions about where they live, and they often identify, it seems, primarily with either the problems or the assets.
Okay, let's talk a little bit more about today's interview. I'll be interviewing two planners, as I mentioned. I've been trying to get them together for some time. They're both interested in the relationship between planning, public health, and well-being. Both of our interviewees are also interested in quantifying the positive impacts of the spaces we create and the places we interact. And, I thought, Layla, you'd be interested in the fact that they are trying to quantify things that we know from our observations are the way people relate to their environment. And there has been a lot of research that demonstrates, for example, the calming impact of a large number of trees in a neighborhood on people's well-being. Anyway, more broadly in our work as planners, and I'm sure you've experienced this, Layla, at Habitat for Humanity, the social determinants of health are paramount. Could you briefly tell us a little bit about some of those social determinants? Because I know you're familiar with that concept.
Yeah, let me think about how to define it. But the social determinants of health are non-medical factors that profoundly influence an individual's and a community's health outcomes. They are the conditions in the environments where people are born, grow, live, work, play, worship, and age. Some of these conditions relate to access to quality education, healthcare, and employment. Other factors include the physical environment, social relationships, and community support.
Yeah, thank you. That's a good overview. So now I'm going to turn to the interview. Layla, do you have? We like to have quotations on here, as well as jokes, which I know you guys are aware of it. David, should I tell another joke before we?
Oh, Brent, I think we're running out of time.
Okay. Well, in that case, Layla, is there a quotation that you think would be appropriate today?
I've got one for you today.
Good.
The more you try to be interested in other people, the more you find out about yourself. And that's Thea Astley. She was a highly regarded Australian novelist and short story writer.
Great. I think that's perfect. All right. Thank you. Let's move on to today's interview. Today's guests are Megan Oliver and David Rouse. Welcome to both of you.
Thank you.
Nice to see you, David.
Yeah, great to see you again, Brent.
I met David a number of years ago when I was a planner in Southwest Baltimore, and this is how Baltimore works. There's a woman I was working with who said, my sister works for a planning firm in Philadelphia, and you might want to go there and meet David Rouse. He's a planner. Of course, I'm from Philly. I went up there, we met, and it seemed like it started a good relationship. David was working at this large planning design firm called WRT, and one of the principals, one of the people who founded that firm years ago was a man named Ian McHarg. This firm did a plan for a part of Baltimore County called the Valleys. And I don't know if you probably don't know too much about this, Megan, but this study formed the framework for the county master plan that was completed shortly before I started as a planner in the county. So these are already some connections here. In any case, in college, I was very inspired by McHarg's book called Design with Nature. In my senior year, I wrote a song called A Vision, inspired by the book. And when I talked to you, David, I suppose that was a surprise to you, wasn't it, the connection there?
Yeah, I remember that day, Brent. You came into our office. I wasn't quite sure who you were, but then you told me you wrote this song on Ian McHarg, and right then and there I knew we were kindred spirits. And by the way, just to say a little more about that, Design with Nature was a great influence on you. In my career, it's what inspired me to go into landscape architecture. Actually, I read that book. Then I went to the University of Massachusetts in Amherst. In my first year in graduate school, who should show up but Ian McHarg lectured our program. I met him, and then later on, in I think it was 1988, I joined WRT, but he'd already left the firm at that point.
This is an audio broadcast, but we're looking at each other, and Megan just held up this. Why don't you tell us where you got that? That's the book.
Yeah, so I was very interested in a very environmentally focused planning in my early days, and so I came across Ian McHarg's Design with Nature. Before I purchased it before I realized how much it does actually talk about the valleys in Baltimore County. So that was a really pleasant surprise as I was diving into it. And of course, now working at the planning department in Baltimore County, we have a conference room named after him and quite a few resources in our library, of course, connected to Ian McHarg because of course, this legacy.
Well, I knew that you guys will have a lot of connections because I've been wanting to get you together for a while now that we're finally in the studio together. By the way, I have a softback. You have a nice hardback copy of the book. That's great. Before we go further, I'm going to pick up my guitar and we're going to listen to the song A Vision.
Sounds good.
Okay. I looked out my window and watched the rain come down. I sat and listened quietly to that heavy pounding sound. A vision came into my head very strong and very clear. I thought of man and what he does. I felt sadness and fear. I saw a million people trampling down the ground, squashing all the life out of everything around. I saw a multitude destroying all my friends, the plants and animals on whom my life depends. I saw them in line, marching straight ahead, with blinders on their eyes. I filled my soul with dread. I heard the world cry out. It grimaced as it died, and I just leaned forward, bowed my head, and I cried. I cried, I cried, I cried. David Rouse has a career that spanned over 40 years as a practitioner, researcher, author, and an educator. His areas of expertise include comprehensive planning, parks and open space, system planning, green infrastructure, planning for emerging technologies. He was a former managing director of research and advisory service for the American Planning Association. He left there in 2019 to start his own consulting practice. David's been doing some creative consulting, teaching, and writing books since then. He tells me he's retired, but it's hard to believe as he continues to do some work for different cities and regions throughout the country. His latest book is called The Comprehensive Plan, and he's working on yet another new book. One thing that always interests me about your work, David, is not only are you a planning professional, you're also a member of the American Public Health Association. And here's a retired guy, right? Am I right about that? That you're actually retired and you're doing all this work?
Yeah, well, first of all, thanks for the kind introduction, Brent. And I don't consider myself retired, but I'm trying to get more towards semi-retired these days. But as you said, I keep myself pretty busy. And you're absolutely right. Public health has been a great interest of mine in planning. I actually came to that working at WRT. I started making the connection between planning and public health. I don't think planners think about that as much. You may ask me about that, but as they should. But I do think the awareness is growing.
Well, yeah, one time when you were in Baltimore, I remember I arranged a lunch and learn for the planners about the intersection between public health and planning, because I knew you were also a member of the American Public Health Association, which was intriguing to me. So even though the session was held in the planning department, there were only a handful of planners in attendance and more than a dozen folks from the health department. What would you attribute that disparity to, David?
That goes back about 15 years now. And in fairness, I think if you had a similar session, more planners would be in attendance. But I do think it highlights something about what's happened in professional disciplines like planning and public health, particularly in the 20th century. If you go back to the original, or at the origins of public health planning and indeed landscape architecture, my degree's in landscape architecture originally, they were all the same profession. You go back to Frederick Law Olmsted, famous landscape architect. In the Civil War, he was appointed General Secretary of the United States Sanitary Commission, which was essentially the first Surgeon General. So landscape architects, city planning, public health were all together. But what happened during the 20th century is that they diverged and became specialized. So only now in the 21st century are the different professions like public health planning and different design professions coming back together, understanding that they need to work together to address critical issues like climate change, chronic diseases, and health disparities, all of which relate to public health. And going back to your question, I think public health professionals recognize that earlier than planners, but it's something that when I was research director at APA, we tried to address, and we developed a lot of resources with funding from Centers for Disease Control and Prevention to deal with public health and promote its awareness among planners.
I think the work of our next guest, Megan, is a good example of these different fields coming back together. We'll hear more from her in a little while. David, I'd like to focus a little bit more today on what's known as green infrastructure. As both of you know from your work, connections to nature are fundamental to our health and well-being. In a few minutes, Megan will be talking about things like measuring people's well-being and a sense of happiness. But before we get into that, David, could you just say a little bit about what green infrastructure is? I don't think that's a term people are particularly familiar with.
Well, the simple definition of green infrastructure is just integrating nature into the built environment, places we live, work, play. So that, thinking about having nature around us and having a regular contact with it. Technically speaking, there's a couple of definitions that have emerged over the years, and so the term itself was first, I think, developed or articulated back in the 1980s by the Florida Greenways Commission. They were doing a statewide, basically open space plan for the state of Florida. What that definition means is thinking at very large scales, the scale of a city, region, or in case of Florida, entire state, thinking about a network of open spaces, parks, greenways, natural areas, and the like, that provide, and this is a key part of the definition, that provide benefits for people, such as public health. I think more recently, and maybe the definition people are most familiar with today, is the idea at a smaller scale, like a site or a street or a neighborhood, of green stormwater infrastructure, which is the use of vegetation, soil, permeable surfaces to absorb stormwater runoff close to where it's generated. And just to tie this up, I think there are these two definitions, but there's really no sharp differentiation between them. And what ties them together again is this idea of ecosystem services, or what's called co-benefits. They provide regardless of scale.
What's meant by ecosystem services or co-benefits?
What these are basically the benefits that elements of nature and green infrastructure can provide for not only people, but the living things we share the planet with, ecosystems, flora and fauna, etc. And one way of thinking about them is they can be divided into three broad categories: environmental, economic, and social benefits, which correspond to the triple bottom line of sustainability. So just to give you a few examples, and the one certainly for green stormwater infrastructure that's best known is improving water quality, reducing flooding, but also things like ameliorating the urban heat island effect or sequestering carbon, which trees do are examples of environmental co-benefits.
That's really important in Baltimore. The heat island is a huge thing in this city and other cities.
And it's a huge public health issue, obviously.
Right. Yeah.
So if you look at economic benefits, just very quickly, instead of attracting visitors to a community who might spend money there, is an example of an economic benefit, but also things like reducing costs, of heating, cooling, healthcare costs are economic benefits that green infrastructure can bring. And finally, again, returning to the theme of public health, improving health outcomes through contact with nature is a very important example of a social co-benefit. So again, public health runs throughout these different benefits that green infrastructure provides.
Yeah, thank you. You mentioned something about this sites initiative. Is that really a way to somehow measure or quantify some of these benefits?
Yeah, absolutely, Brent. Sustainable Sites Initiative was originally developed by Lady Bird Johnson Wildlife Center, I think, way back when. It's basically a LEED rating system, LEED for buildings, green building rating system, but it's applied to sites, landscapes. So it's a rating system for landscapes to measure how sustainable they are. And human health and well-being is one of the major categories of the sustainable sites rating system. And it has specific criteria for how landscape designs and site designs can promote human wealth and health and well-being.
I like that. When I was in graduate school for planning, a lot of the architecture school was next to us, and a lot of it is about the vertical development, the buildings. And one of the guys in my class was a landscape architect. And I love that we're talking about the horizontal aspects. LEED is more a rating for the buildings, and this is, I think, more for the site, which is what I love. When somebody says, "What's a planner?" First of all, I think it's a mindset. We don't just look at nature. We don't just look at housing or roads or economics. Our minds, I think, see what you guys think, that we have to see the whole picture, because it's like the three-legged stool, right? If pieces are missing or one leg is missing, the stool falls down. So, Megan, do you see that as a fair assessment for how planners think?
I think that's definitely changing nowadays. And as we're talking about rating systems and looking at the vertical infrastructure of a building and the horizontal infrastructure of the site, I'd be remiss if I didn't mention also the well-accredited professional certification, which is a new and budding certification program similar to LEED, similar to sites, that is taking a data-driven approach to help architects and designers, landscape architects and planners, to create buildings that take into consideration the health impact on the occupants. And so it looks at the impact of the lighting, it looks at impact of air quality, thermal comfort, movement. It has a whole series of these different topic areas where it's exploring health and well-being in the built environment, and how an accreditation system might be able to help designers and planners and architects to create spaces that are better for us.
Well, thank you. We'll keep the dialogue going, but David, I want to thank you for your ideas today, and I'm sure you'll be back for other things, because I know you're working on a lot of other subjects. Megan, before we talk about what you've been doing, do you remember where we met? I think you were working for May and Reichel, a playing design firm, just like with David. I mean, there's all these connections, and years ago somehow we connected. Do you remember? I don't recall what it was.
Small to more, the way that we're all connected, of course. But I actually, many moons ago, interned with the Baltimore City Planning Department's Office of Sustainability. And so while I was there, I was working with Kristen Baja, this amazing woman who's done a lot of climate resiliency work, and at the time was helping Baltimore to create the disaster resilience plan. And so I think I had a little tiny desk in the middle of a hallway outside of your office.
Oh,
and
okay.
that's how we first met. And then, yes, you're right, a few years after that, I started working for Mahan Reichel Associates, a design firm, landscape architecture, urban planning and design firm based in Baltimore.
Well, I think it's interesting that you have a bachelor's degree from Maryland Institute College of Art in environmental design, and then at Morgan State University you got your master's degree, and you were also focused on some of the same issues. But of course now you're at Baltimore County. One thing that really interests me a lot, and you put a lot of this on LinkedIn, you have this consulting business called Hello Happy Design, What a great name, and how'd you come up with that? And tell me a little bit about what Hello Happy Design is.
Yeah, absolutely. Well, I'm glad that you like the name. It's a little light and bubbly, but I wanted it to be welcoming and approachable and friendly. The hello part of it is meant to invite the start of a conversation for a couple of reasons. One, because I'm very focused on the impact of the built environment on our mental health, and I think it's really important to open up conversations about mental health, to destigmatize mental health, but also because a big focus of my work is on participatory design and inviting those conversations with the public to allow them to shape their communities, to help the planners be shepherds more so than the creators themselves. I really want the community members themselves, those who will live with the decisions of our plans, to be the ones who are helping to guide that conversation. So the name Hello Happy Design is meant to be really an invitation, a greeting to start these conversations about how we can shape communities for our health and well-being, which is something that I think I've always been really keenly aware of. That's the impact of our surroundings on our health and well-being, our health and happiness. I started with an interest in interior design because I knew that the rooms that I spent time in changed my mood, my attitude, my behaviors, and I wanted to be able to shape environments that helped to foster positive experiences, and that eventually scaled up to architecture and ultimately to planning, as you noted.
Well, so here's another field. We bring in interior design.
Yeah.
Again, as everybody's in their silos, but as planners, I think we keep thinking about how can all these disciplines come together.
Absolutely, and I think those conversations are starting to happen, as David also started to allude to. Like we're starting to get the overlap. All of the folks back at the table, public health researchers, scientists, interior designers, landscape architects, and planners, everybody all around the same table to bring their own expertise, and so that's really exciting. And just to get back to the, I think a portion of your question about why I started this practice of mine, it really began in earnest as I was in this season of my life where I was experiencing loss after loss, and I was doing a lot of personal work to get into a good headspace, but I noticed that I was moving through this world that was, for the most part, oblivious to my mental health needs. And so it seemed like our world just so desperately needed spaces that were intentionally created to be joyful and healing, and so I felt that this was really where I needed to direct my attention.
Yeah, you asked some really intriguing questions. I mean, this podcast is really about connections and forming community and so on. And I just want to mention one of the books that I really liked is called The Happy City. And it was written by a guy named Charles Montgomery. And he talks about the mayor in Bogota, Colombia, who in the early 2000s, Enrique Penloza posed the question, can you imagine if we designed the entire city for children? I don't think that's something that we talk about, but it's a great grounding place. But he was able to implement this idea. I quote him as saying, we need to walk just as birds need to fly. We need to be around other people. We need beauty. We need contact with nature. And most of all, we need not to be excluded. We need to feel some sort of equality. And what he did as a mayor, because he had the power to do this, instead of expanding highways, he built hundreds of miles of bike paths, a chain of new parks and pedestrian plazas, a network of new libraries, schools, daycare centers, and the city's first rapid transit system. And actually, he did this bold experiment of saying no vehicles in the city on this one day. And of course, people had pushback, but they responded. You saw people on the transit, people walking. They loved it to the point where back then the citizens responded favorably by making this a yearly event. So his question was, what if we designed a city for children? And I've seen some of the questions you've asked, Megan. What if we designed spaces and places for the nervous system? Should planners be trained in psychology? Should mental health data be used in zoning decisions? And so how do you pull all that together?
Yeah, I think those are great questions. I'm going to dive into them in a second, but I also wanted to acknowledge the two individuals that you mentioned and some other resources. First, Charles Montgomery, the author of this book, Happy City, started a firm that's now called Happy Cities based out of Vancouver, and they've been such an inspiration to me. They're really doing a lot of the work that I'm also passionate about, looking at how to create places for people. And so for any of your listeners who are interested, Happy Cities shares a lot of their work and a lot of their research online for free for professionals and community members to utilize. So absolutely would love to point your listeners in that direction. And then also Mayor Peñalosa's brother, Gil, who was the commissioner of Parks and Recreation in Bogota, came to Baltimore at least a handful of times and was able to talk about the ciclovia, the closure of the streets, the Sunday Streets program that he helped to reinforce. It was already ongoing prior to his role as commissioner, but he was able to reinforce it in Bogota. And so it was such an honor to hear him talk about that and to see the ciclovia start to take shape in Baltimore. I think over the years it's kind of faded, but I'd love to see it resurrected if possible.
I've met Gil Peñalosa several times. He's got this organization called 880 Cities, which Megan probably knows about. And the premise is if a city works for 8-year-olds and also works for 80-year-olds, it'll work for everyone else. So it's a very strong concept. I think his organization is based in Toronto, and they do a lot of working with communities to close streets down.
That's another good question. Does a city work for an 8-year-old and an 80-year-old? We can help people evaluate that, and those are the good questions to ask as planners.
What if we design spaces for the nervous system, and should planners be trained in this sort of work? I think there's a lot of recent research that's revealing many ways that our bodies respond to the world around us, and it's often in ways that we're not consciously aware of. So I think planners, designers, people who've shaped the built environment on some level can intuit some of this information. We've observed, or we see that people respond differently to the environments that we're creating. But now we can use biometric technology, technology that can be worn to measure different things that are happening in our bodies when we're in public spaces. So we can go into a public space and we can measure things like heart rate variability or blood pressure, or we can see where our eyes are moving. And all of these can be used to help us understand how people are responding to a place. And we can see if their heart rate is going up and down, that might indicate that they're stressed and not really in a calming environment. Or if their blood pressure is going up, we can kind of deduce something similar. There are, of course, much older studies as well. I think your listeners would probably be aware of Ulrich's study, View Through a Window, which found that patients who were recovering from surgery benefited from a shorter recovery time and fewer requests for pain management when they had a view overlooking nature. So as David was talking about earlier, we have this hardwired preference for natural environments. And so, long story short, I think our whole bodies really respond to our environments in different ways. So, to some degree, yes, I do think that planners should get some training or some awareness of psychology or the psychological processes, how we sense things, our perception, how we make judgments and assessments of the experiences, or of what we experience, I should say. And combine that with an understanding of our shared human preferences for these certain landscapes and experiences and landscape elements. I think all of that would help to shape places that better meet our physical, mental, and emotional needs. I think land use and zoning should help to promote the things that we're understanding are really important to us. So movement, getting outside, building a social community, supporting affordable housing, all of that. But currently low-density, car-centric zoning laws really compromise the health of our residents, so this becomes a public health concern. And I think I'll conclude just really quickly by saying I think that too few planners are making this connection between the work that they're doing and our human physiological and psychological needs. And so they're inadvertently downplaying the importance of their own work, because they really could be shaping zoning policy and other decisions that foster a built environment that better helps our physical and mental health.
One thing that I was always talking about when I was in the planning department, and this is true, David, I'm sure in lots of places, the zoning board is supposed to consider health. And I said, there's no definition of health in the zoning code. So it becomes this sort of physical analysis. And I'm like, why don't we define health? Because then the commissioners looking at zoning have some reference point. If we don't define it, then it gets lost.
Yeah, well, Brent, the whole basis of zoning is public health, safety, and welfare, which is all
Right.
about health. Yeah, and that's that connection between planning and health that I mentioned earlier has gotten lost. And I think it's coming around back full circle. I think there's more and more awareness of the importance of health for the work that planners do.
When you're working in other places, please ask them if they can define health in their zoning code, because that's one thing planners have a lot of influence on is zoning. And one reason I was interested in this, Megan, is because we're in a culture that likes to quantify things. So we can say, yeah, people feel better and so on and so on. But if you're measuring heart rate and other sorts of things, we can say, listen, these are impacts that we can measure. And I think that may resonate with some people who say, what are planners doing? What do they have to do with anything? So bringing together the data and this idea of mental health and well-being, which I think most people can relate to, so that when we talk about things like the heat island impact or climate change, which I think if we break it down into things like wildfires and flooding, I mean, those are things that people can relate to. Those are things that planners can have an impact on. I'm really glad that you two could join. Does anybody want to add anything at the end before we close?
If I were to leave your listeners with a nugget of inspiration or something to kind of stir their next steps, I'd really like to reinforce that I think the opportunity before us is to bring all of these different professionals together. We don't have to be neuroscientists to start applying scientific insights to our decision making and shaping public spaces. We don't have to be public health experts to start applying a health in all policies lens or just a health approach to the work that we're doing. We really can start to lean on one another and pull in our counterparts, our partners, everybody else who's in these other fields to all point ourselves towards the same goal, which is just to create spaces and places that help us feel happy, healthy, joyful, and well.
That sounds great. David, anything you'd like to add?
Well, I agree wholeheartedly with what Megan said, and I think a step you can make is if you don't already do it, reach out to your public health colleagues, the health department, or whoever is working on these issues. They're really eager to make the connection, but they don't necessarily know how. I always tell public health professionals, get involved in comprehensive planning processes, for example. So that's just one simple step you can make to start building these connections.
That's great. Megan, I'm going to keep following you on LinkedIn. I know recently you brought a bunch of people together around these topics. It's very inspiring to me. And I really wish you both well in the work. And if other people that can come and have this dialogue, I mean, they say that people have to hear things 3 times before they get it. So this is one time. And I hope we'll continue the talking this topic in the future. So thank you both, Megan Oliver and David Rouse, for your time today.
Thank you.
Yeah,
Brent,
thank
David,
you.
It was a great conversation.
Today's episode would not be complete without a word from one of our sponsors. I'm really excited about today's sponsor. Are you feeling unbalanced, lightheaded?
Oh, my head is spinning.
Do you faint easily? Do you sometimes feel you're floating away?
Somebody help me.
Would you like to be more grounded? Well, we've got the product for you.
Oh, goody, goody. What is it?
It's invisible.
Invisible?
Yes, and it has a very powerful force.
That sounds awesome.
It will keep your feet to the ground.
I'd like that.
In fact, it keeps everything anchored.
I can't wait. What is it called?
This powerful product is known as
Gravity.
Do Get a hit of it now. Call 1-800-GRAVITY to get a free sample. You won't be disappointed.
There is no fancy gadgetry, just gravity. Make that call now.
This has been Inquire and Inspire, a podcast exploring connections and community. With our hosts, bodacious Brent Flickinger and laughing Layla Kohler-Frew. Our engineer was David the Dynamo Heath. We also want to thank our behind-the-scenes people. Our pricing consultant, Mark High. Our data and fact checker, Noah Authority. And our all-important budget accountant, Donna Addup. And be sure to support our sponsors. If you enjoyed this podcast, please rate us and subscribe wherever you get your podcasts. But more importantly, please tell just one other person about it. Word of mouth is the single best way to share something good. If you have comments, questions, or feedback, or if you want to suggest a future guest, please email Brent at flickinger.com. We look forward to hearing from you.